welcome back to MedComplete Board Review. Today we have a 35-year-old female with a past medical history of spontaneous pneumothorax. She presents to the ER for chest pain and difficulty breathing. The chest x-ray in the ER reveals a spontaneous pneumothorax of the left lung. The patient is treated in the ER and stabilized. The patient has never smoked. She takes no medications. Due to the recurrent pneumothoraces, a CT of the chest was done. Which of the following is the most likely to be found in this patient? Hey everyone, welcome back to MedComplete Board Review. So the answer to the previous question we posted regarding our 35-year-old female with multiple pneumothoraces is C. Renal angiomyolipomas are the most likely thing to be seen in this patient. This question is a hard question, and it's one of the questions that people who score the highest on the medical board or USMLEs are usually going to get right. You need to know a lot of pieces of information here to get this question correct. So first and foremost, you need to know what the diagnosis is. So whenever they give you a CT of the chest, or they describe to you a young female who is a non-smoker and is developing multiple pneumothoraces with cysts all over her CAT scan, this is LAM, lymph angiomyomatosis, and the short term is LAM. So LAM occurs predominantly in females, and usually they're younger females of like premenopausal age, and they usually do not have a history of smoking. That's very important. And 1/3 of those patients present with spontaneous pneumothorax, because obviously these cysts that you can see here, all these air bubbles here, these obviously burst and they give the patients pneumo, and 1/3 of these patients, that's their initial presentation to us. The one thing you want to know about LAM is the same gene that causes tuberous sclerosis is the same gene that's a problem here. It mutated a little bit differently. So although due to the different mutation they get a different disease than tuberous sclerosis, the extrapulmonary manifestations are the same as tuberous sclerosis. So if you guys remember tuberous sclerosis, they get cardiac sarcomas and then they get renal angiomyolipomas. The same thing you would see in LAM. So 1/3 of patients who have LAM will have renal angiomyolipomas at the onset of diagnosis. So the other thing they could have asked you is, what is the next step that you should do? You should go and ultrasound the kidneys or CAT scan the kidneys to look for these. Okay. These patients, obviously, their lung function deteriorates over time. The only drug that's approved for this is sirolimus. Interestingly, the same drug we would use in tuberous sclerosis because it targets the similar protein, the mTOR protein. And here, the sirolimus is the only thing that's been shown to reduce the time of lung deterioration. Ultimately, these patients need lung transplantation. Okay, so going back to our answers, colon cancer, many things can give you colon cancer. Obviously, there's an entire list, but the most common on your exam tends to be like inflammatory bowel diseases like Crohn's or ulcerative colitis. Endometrial carcinomas, the only genetic disorders that they generally test you on would be Lynch syndrome is usually a popular one that comes up a lot. Liver cysts are not found here, but they're found in adult polycystic kidney disease. Those patients can get liver cysts and pancreatic cysts. We'll do questions on each one of these later. So diabetes insipidus is here for a reason. It's a distractor. So the other disease differential here with these cysts is pulmonary Langerhan histocytosis. So those patients also have cysts bilaterally, and they can present with pneumo, and they are predominantly in females. However, the distinction is that the cysts in the Langerhans tends to be thicker. I don't think they'll test you on that, but the difference clinically is that those patients are smokers, okay, predominantly. 90% of them have a smoking history. So on the exam, the way you're going to differentiate LAM from pulmonary histocytosis is the smoking history. So if they tell you that she never smoked, you're going to go with LAM. If she did smoke, you're probably going to go with pulmonary histocytosis, okay? And the reason diabetes insipidus is here is because 20% of the histocytosis patients have diabetes insipidus, okay? Breast cancer obviously has nothing to do with this. There are many conditions that give you that, like the BRCA gene mutations, etc. Okay, I hope you found this, guys, helpful. Please leave your comments in the section below, and please subscribe to our YouTube channel to support us, to keep us making videos like this for you in the future.